Back to breaking news we've been following. Autopsy results reveal that actor Matthew Perry died, at least in part, of the effects known of the drug known as ketamine.
Dr. Scott Hadlin's an addiction specialist at Mass General Hospital, and he joins us now to talk more about this. Dr. Hadlin, thanks for your time.
Thanks for having me.
So what do we know about this drug, and what can it do to the body?
Well, ketamine is a medication that's actually commonly used as an anesthetic for surgery. What it does when it's in the body is it acts on the brain to cause dissociation, make someone feel like they're not present. At higher doses can cause someone to lose consciousness. And it also is an effective treatment for pain in the moment. And so you can see why it would be an effective anesthetic. Increasingly recently, too, it's also been used as a form of treatment for people who have depression that's resistant to other medications. And actually, it turns out Matthew Perry was receiving that kind of treatment, but that treatment is when ketamine is actually given in a healthcare facility. The patient is carefully observed, often given at a hospital. And the last treatment that he had gotten was about a week and a half before he died. And so the medical examiner's report tells us that this probably wasn't related to his death. Actually, probably what caused his death is that he took ketamine at home separately, and ketamine is a medication that can sometimes be misused in this way. People will use it sort of recreationally or sort of personally, and it's very dangerous when it does this, when it's used this way. It turns out that he has a history or had a history of heart disease, and probably what happened is that ketamine at high doses overstimulates the heart, probably caused him to lose consciousness, and then that resulted in him drowning.
Yeah, the levels kind of too high in his blood to have been from the treatment sought in a professional setting. So the autopsy report also showed another drug in his system, apparently one that's used to treat opioid use disorder. So how could that have played a role in all of this as well?
That's right. Actually, the medical examiner's report suggests that this probably wasn't strongly linked to his death. The medication was buprenorphine, which also sometimes goes by its brand name Suboxone. It's a very commonly used, life-saving, and very safe medication used to treat opioid use disorder or opioid addiction. And in his case, it was found in his bloodstream at therapeutic doses, meaning that he was probably taking the medication either to treat opioid addiction or perhaps pain. It's sometimes used that way, but he was taking it likely as prescribed. And the medical examiner doesn't believe that that contributed significantly to his death.
All right, good information, Dr. Scott Hadlin. Thanks so much for your time. We appreciate it.
Thanks for having me.